The advanced technology and scientific approaches of the ancient Egyptians continue to amaze us even today. Especially their discoveries and practices in the field of medicine form the foundations of modern medicine. Here are some astonishing facts about pregnancy tests, gender determination, and birth control in ancient Egypt. The Kahun papyrus, discovered in Egypt in 1898 by scientist Sir Ebers Papyri, along with the Smith papyrus found in 1862 and the Ebers Papyrus found in 1873, contain information about pregnancy, urinary diseases, varicose veins, and pregnancy tests. According to information in papyri displayed in museums, a woman suspecting pregnancy would water 2 bags daily with her morning urine, one filled with wheat and the other with barley. Another woman without pregnancy suspicion would also water separate bags of wheat and barley with her urine. If the wheat and barley-filled bags watered by the woman suspecting pregnancy sprouted earlier than those watered by the other woman, it was understood that she was pregnant. If the wheat and barley watered by both women sprouted simultaneously, it indicated no pregnancy. Because pregnant women's morning urine contains an excessive amount of hormones, the wheat and barley bags would sprout much earlier than those watered with normal urine. Today's use of hormones to grow fruits and vegetables faster is similar to this method. Gender of the baby. In the method used by the Egyptians, the gender of the baby could also be predicted. If the wheat grains sprouted earlier from the seeds watered with the pregnant woman's urine, it was understood that the baby would be a boy. If the barley grains sprouted earlier, it would be a girl. Professor Julius Monge in 1933 proved the accuracy of the Egyptians' pregnancy and gender determination method by watering wheat and barley grains placed on drying papers in boxes in the laboratory with urine. Today's pregnancy tests also provide results based on the concentration of hormones in a woman's urine and are applied according to the same principles. Birth control. To detect infertility in women, Egyptians placed garlic or onion at the cervix, uterus, before going to bed at night. If the woman smelled garlic or onion in her sinuses when she woke up in the morning, it was understood that her tubes were open, and there was no obstacle to getting pregnant. If no smell was detected, it was known that the woman's tubes were closed, and therefore she couldn't get pregnant. Additionally, pregnancy was prevented by placing a gold or silver ring, which are non-rusting metals, inside the woman's uterus. Arab caravan drivers also learned this method and would fill the uteruses of female camels with cleaned pebbles to prevent them from getting pregnant during long desert journeys. The birthing process was typically managed by experienced midwives. These midwives underwent special training called jet. The most commonly used position during childbirth was the squatting position, and special birthing bricks were used for this purpose. To facilitate birth, abdominal massage was applied, and various oils were used to lubricate the birth canal. For pain management, herbal analgesics such as poppy and mandrake were used, while music and singing were also preferred to reduce pain and provide relaxation. The Ebers Papyrus contains special recipes for difficult births. For example, it was recommended to mix fresh cinnamon oil with hot water and apply it to the woman's abdomen. Plants with effects similar to oxytocin were used for bleeding control, and uterine massage was applied. Although there is no conclusive evidence that cesarean sections were performed in ancient Egypt, examinations on some mummies have shown traces of surgical intervention in the abdominal area. The placenta was usually buried or thrown into the Nile River, and sometimes it was dried and used for medical purposes. Postpartum care was also very important. New mothers generally received a special diet and care for 14 days, during which they could stay in special birthing houses called amaze. Breastfeeding was encouraged and typically lasted up to 3 years. Various herbal mixtures were used as milk enhancers. Don't forget to subscribe to my channel and like my videos for more videos like this.